Dr. Johnson is in, and you have been added as a co-host here.
We're ready, Dr. Johnson, if you are. If you want to just say a few words, and then we'll open it up to questions.
Great, thanks. Just getting set up here. Thank you, everyone, for joining us this afternoon. You all received our press release, and we've updated our information on post-vaccination cases. And as you can see, we're in line with what's happening across the nation. Since a lot more people are vaccinated, we see more cases in vaccinated individuals as expected. But the great news is the vaccines are still working and working very well in preventing severe illness and hospitalization. So that's what we expected to see. And so more encouragement for people to get the vaccine to prevent hospitalizations and severe illness. So I'd be happy to take your questions.
Thank you. First up, it looks like we have Jamie Bettner. Jamie, I'll give you a request to unmute. You may now.
Hello there.
Hello.
Hi there. I've been hearing more and more about just rumblings of more children will be eligible to get the COVID-19 shot. And considering school is back in session, I was wondering if you could comment at all on preparations happening behind the scenes with the state. Has there been talk about having school clinics? Have you been talking about working with pharmacies? Because a lot of pharmacies right now are already overrun by flu shots and boosters and so forth. And talk about how you'll handle more children being added to the list.
Sure. Well, thank you. We are anticipating that there will be authorization, at least for the Pfizer vaccine, for the 5 to 11-year-old age group. So we've certainly been preparing for that. As you recall, there was a Secretary of Health's order for schools to coordinate with providers in their communities, and for providers then to offer to host or assist them with vaccination clinics on site. If providers were not able to provide that function, they can reach out to the Department of Health, and our team has worked to coordinate those sort of efforts as well. We also have been increasing the pediatricians in our provider network and assisting them in terms of getting set up to be able to give those vaccinations. So we are looking at all different provider types to do those vaccines, but we certainly have been planning for it, and based on the provider network that we have, feel that we are well positioned to accommodate the influx of kids that we'll see once that vaccine is authorized.
Next up, we have Jason Laughlin from the Philadelphia Inquirer. Jason, you may now unmute.
Hi, thank you. Doctor, looking at the overall hospitalization rates compared to what you've got over the past month, it was just about 7% of people that were vaccinated that were getting hospitalized since the course of the vaccination program began. Now it's more than a quarter. Is that just a factor of more people being vaccinated? Because it seems like that doesn't account for it completely. That's a pretty huge jump. How much is waning effectiveness and the Delta variant to account for those numbers today?
Well, I believe you're right. It's all of the above, right? And so that we don't have a really good way of telling what portion is attributed to what factor. We know for sure that with more people vaccinated, we will see more infections in those vaccinated. Just imagine that, remember that the vaccines are not 100%. So there always will be some people who will get an infection after being vaccinated. And if 100% of people are vaccinated, we still are going to have some cases. And then those cases will be 100% of the vaccinated. So, it sort of is just a math issue. As more people are vaccinated, there will be more infections in those groups. But we also have been tracking that information, and you know that Pfizer then has authorized booster doses for people with certain conditions. And we have seen from the data that there is some waning immunity, especially in the 65 and older. So that certainly will contribute as well.
Thank you so much. Next up, we have Tim. Tim, you may now unmute.
Hi, thank you for taking my question. In the press release, Dr. Johnson is quoted as saying that means fully vaccinated people have a greater than 3 times better chance of staying out of the hospital due to COVID-19. My question is, how is that 3 times greater calculated? It seems to me that if, say, 2/3 of the people are vaccinated are accounting for less than 1/4 of the cases, if you look at the 2 base rates, it actually should probably be a little higher than 3 times.
Let me have our communications team go through that in detail with you. But certainly people who are vaccinated have much less risks for hospitalizations. We are still seeing the majority of hospitalizations and severe illness in those people who are unvaccinated. But to work out the math and the detail, let's do that offline.
Thank you. Next up, we have Brett. Brett, you may now unmute.
Hey there, thanks for having this call today and taking my question. I too am interested in the idea of waning immunity playing a role in increasing case rates. And I guess I have to wonder if it's even, if we're just looking at it through the binary of vaccinated and unvaccinated, if it might be more useful for us to, I know it might be difficult to do, look at how long ago someone was vaccinated. And also, I think we just have a simple question for people who are vaccinated. What's kind of the message for them then if they were vaccinated in January, February, March, and they're seeing that their immunity is waning, and that it seems increasingly likely that they will still get COVID? What's the next step for them, and how does this data play into that plan from you?
Sure. Well, as you point out, the more data that we have, the more our decisions are going to be informed. And so the data that we have been able to aggregate and put out is just that. It's an aggregate, as you say, vaccinated and unvaccinated. So our chore, and the chore of all of those who are studying this, is to find out the details of those cases. As you know, for the state, our systems are pretty disparate, and so that aggregating that data is a heavy lift, but that's just the first step. And so that we want to find out then who are getting these cases, how long have they been vaccinated, what are their underlying conditions, how old they are. All of that information is what we're working on, but certainly don't have the answers yet.
Thank you. Next up, we have Sarah. Sarah, I'm sending you a request to unmute now. Sarah Bowden, you should be able to unmute.
There we go.
Thank you.
Hi, Dr. Johnson. Thanks
Hello.
for taking my question. So I know that a number of hospital systems across the country are triaging or making decisions on medical care based on vaccination status. For example, I believe there's a health system in Oregon who are bumping unvaccinated organ recipients to the bottom of the list because they refuse to get vaccinated. I was wondering if you could comment on what your thoughts are on that sort of policy.
So I don't know in Pennsylvania that that sort of policy is in effect. I know that certainly in transplant patients, when the facility is going to do a transplant, they want to do it on the people who are best able to maintain that transplant. And so many organizations will have exclusions. I don't believe that there's a national exclusion list. It depends on the facility, but the facility has to make the decision on the chances that that transplant, a very precious resource, is going to be able to be maintained in that recipient. So, not I can't make a determination on their decision, but I know that those sort of considerations go into the decisions that they have to make.
Thank you. And next up, we have Tom Lehman at WJL. Tom, you may now unmute.
Dr. Johnson, thanks for taking our questions. I'm wondering, earlier it was brought up, sort of the relative increase that we saw in the last 30 days among vaccinated people in cases. But I'm wondering, can you speak to your concern level about that in the sense that, we're only just getting the boosters rolled out right now. The number, I guess the percentage wise, was pretty significant. Can you speak to your concern level about that, and I guess sort of the importance of the booster rollout at this point?
Well, I think that, again, I think that people really need to realize that the vaccines still are working. And so that really don't want people to be dissuaded from getting that primary series of vaccine because they think that it's not worth it. It really makes a difference. In terms of the waning immunity, I think that that's something that has been followed, and we know that in certain populations there can be that waning immunity. That's why the booster shots. But I think I would still encourage people to get that primary series because it does give you a high level of protection. Certainly nothing is 100%, but it's much, much better protection than not being vaccinated. And I think Pennsylvanians are seeing that. We still are seeing that even though we are administering a fair amount of booster shots, we're along the same lines as the rest of the country in terms of the proportion of boosters that we're doing. But what we're also seeing in Pennsylvania is that we are giving more of that primary series. Nationwide, they're seeing that they're getting more boosters and primary series. We're still getting more primary series vaccinations, and that's a good thing.
Thank you. And next up, we have Nicole. Nicole, you may now unmute.
Thanks, Dr. Johnson, so much for doing this and for taking our questions. I wanted to follow up, if I may, with a previous question regarding the data points. Your response, I was a little unclear about what other data points the Department of Health may be collecting as to, somebody, when you have a breakthrough case, whether or not they were vaccinated more than 6 months ago, and then what type of vaccine, since there seems to be a question about the dosage in a Pfizer versus a Moderna, for example, and how much the protection drops off. If you could address both those questions, I'd appreciate it. Thank you.
Well, I think we'll have to follow up with you. I don't have all of the data points that are being collected. I know that there's research being done not only in Pennsylvania, but nationwide. There are really hundreds of researchers that are looking at every aspect of COVID. And so that I know that there are studies going on looking at the length of time since primary vaccination and a post-vaccination case. They're also looking at underlying medical conditions and others, but I can't give you specifically the things that we're looking at here in Pennsylvania, but we can certainly follow up with you on those items.
Thank you. First, we want to take a round of questions, make sure every reporter on the call can ask their first question. So I'm going to toss it over to Paul Go. Paul, I'm going to send you a request to unmute yourself in just a second. All right, you should be able to unmute. Paul, it looks like you're unmuted, but we're unable to hear you. I'm gonna try you one more time here, and if not, we can go to the next question and come back. All right, we'll come back to you. Next up, we have a question in the chat from Eugene Tober from the morning call. Why is January 1st used as a baseline when, by definition, no one in Pennsylvania was considered fully vaccinated until January 18th? Isn't that loading thousands of unvaccinated people into the data?
I think we just looked to start at the calendar year, so I don't think we were looking at that. I think you raise a good point, but we just looked to start at the beginning of the year.
Thanks, Dr. Johnson. And Paul, I'm going to send it right back to you to see if we're able to get this working. You should be able to unmute on your end. I'm sorry, Paul, we're not hearing you on our end. If you want to add your question to the chat, we'll be sure to take it from there. We do have some reporters with second questions. So if you do have a first question, feel free to raise your hand. If not, we'll try to get through as many as we can with the time we have. Jason, you may now unmute.
Thanks. Another question, Doctor. You mentioned earlier, if I understood you correctly, that as of right now, the state is blind to a lot of the demographics in play here. We've been talking about which dosage people took, when they took it. You said age is not something that you know right now. How can the state be making policy decisions when it doesn't have this basic information about people's vaccinations?
So the information that we have is aggregated right now. So we have large numbers, but we can't tie it down to an individual. So to tie it down to an individual, how long they were vaccinated, that takes more of a manual effort. As you can imagine, our team has been pretty overwhelmed in terms of the amount of work that they can do. So they have released that aggregated data, and the work now is to be able to dive down into that and get some more detail. But it's a large amount of work to do, but they're taking it on.
Thank you. I'd like to read a question in the chat for Paul here from the Pittsburgh Business Times. Can you tell me if Delta variant remains the dominant strain of COVID? Are there other COVID variants like Mu that are getting a foothold?
Sure. So Delta is definitely the dominant variant at the time, and we have probably about 99% that's Delta. The Mu variant is present in very, very small numbers, so less than 1%. And that speaks to the transmissibility of the Delta. Once we've seen Delta kind of come into the area, it really has outcompeted all of the other variants. That's not to say that we're not going to have another one that is more transmittable than Delta that will take over, but right now Delta is by far the dominant variant.
Thank you. Next up is Tom. Tom, you may now unmute.
Dr. Johnson, I just wanted to check for my sake, and I apologize if this was already answered or if this is spelled out clearly somewhere in here. But do you have any data on whether people who received the booster shot already, and I know that's kind of a narrow time frame, but I would think that there may be some possibility of that data being in there. Do you know if that factors in at all to the data that was released today?
I don't think that we have enough data to connect it. It's not been that long that people have been receiving those third doses. Certainly a large number of people have already, but we can't connect it to any of these cases here, at least not on a specific basis.
Thank you. And next up, we have Brett again. Brett, I'm going to send you a request to unmute.
Hey there, I just want to make sure I'm understanding this absolutely correctly, because I see that over the past few days we have an average of about 5,000 new cases a day, which is on par with April 2020 or some of the other surges we saw. So when you make this metaphor related to seatbelts, I'm just trying to understand, are you saying that more people who are in the hospital with COVID are vaccinated but overall we have far fewer people in the hospital, or are you help me make sense of that, because I don't necessarily think that I understand when what it appears to be is that the data shows that the vaccine is less effective at keeping people out of the hospital than it was a few months ago. So and I want to make sure I have a really clear understanding of what you're saying on this. Is that the case? The vaccine, because partly of time, is less effective at keeping people out of the hospital than it was a few months ago, or do I not understand your statistics correctly?
Well, I think there are several factors that are leading to the increase that we're seeing in the post-vaccination cases. So as we noted with the data that's released by the CDC and the FDA, there is a factor of waning immunity. So yes, there are some individuals who have more of a risk of having a breakthrough case because of waning immunity. But we also know that we have a lot more people that are vaccinated. And so that before, if there were only, a small percentage of people that are vaccinated, then we would see more cases in the unvaccinated and less in the vaccinated. As there are more people that are vaccinated, just by sheer numbers, more of them are going to be in the breakthrough cases. So we certainly are seeing that. And we also know that the overall cases have ticked up because of the increased transmissibility of Delta. So it's not one factor. There's several in there that play into it. But again, still being vaccinated has less risk of hospitalization and severe disease than not being vaccinated. So a combination of factors that play into it. Does that make it a little clearer?
Brett, if you do need clarification, just let us know. Next up, we have Sarah Bowden. Sarah, you may now unmute. If there were any reporters that joined us in the chat and would like to ask a question, please feel free to hover over your name so we know to call on you, or add your question in the chat there. Thank you.
Hi, Dr. Johnson. Thanks for taking the second question. I know that some people are going ahead and getting boosters even though they don't fall into the recommended categories. I'm wondering if there is an adverse health reason to do this. Like, I understand that it's not recommended, but would someone actually cause long-term, I don't know, would it screw up immunity down the road, for example, if they got a booster before, they were recommended to do so?
So not that I know of, there's any indication for that, but we're certainly not recommending people get vaccines that we don't think that they need. The reason for recommending in these certain populations is because we know that there can be waning immunity, and we know that there are some people at higher risk. So we're recommending those boosters based on their risks. And so certainly not recommending that people get this if they are not in one of those categories.
Thank you. And we do have a question in the chat from Paul Go at the Pittsburgh Business Times. Can you tell if there is an uptick of serious disease, hospitalization, and death among nursing home residents, a group that was hard hit in the past waves before vaccinations? If so, is this an outcome of waning immunity?
So I don't have the statistics before me in terms of the nursing home outbreaks. I know that those are available on our website, but yes, we have seen some outbreaks in nursing homes. Waning immunity can be part of it, but what we have seen through this pandemic and even now is that the cases that occur in the nursing homes are a result of cases that are or infected people who come into the facility from outside. Often that is staff. And so that's why we're working really hard with our nursing homes to make sure that we get staff fully covered with vaccines, because that certainly has been a source of outbreaks within the nursing facilities.
Thank you, Dr. Johnson. It looks like that is all the hands raised and questions asked for today. If any reporter on the line does have further questions, you can always feel free to contact the DOH press office, and we'd be more than happy to assist you. Thank you all for joining us today.
Thank you.